Welcome to our comprehensive guide on understanding and managing stress. As a neurosurgeon, I've seen firsthand the impact stress can have on the human body and mind. It's something we all experience, but if left unchecked, it can really take a toll on our well-being. Today, we'll explore the signs and symptoms of stress, how it's diagnosed, and effective treatment options. We'll delve into the science behind stress, looking at how it triggers physiological changes in the body and can manifest in a variety of ways. Understanding stress is the first step towards managing it effectively. By recognizing the signs and symptoms, understanding the diagnosis process, and exploring available treatment options, you can take control of your stress levels and improve your overall health and well-being. Stress. It's that feeling of being overwhelmed, like you're carrying the weight of the world on your shoulders. But did you know it can manifest in many different ways? It's not just a mental thing. Let's talk about the physical symptoms first. Have you been feeling more fatigued than usual? Are you experiencing headaches more often? Muscle tension, particularly in the shoulders and neck, is a common sign of stress. And then there's the digestive system. Stress can wreak havoc on your stomach, leading to issues like heartburn, indigestion, and even changes in bowel habits. Now, emotionally, stress can leave you feeling drained. It can trigger feelings of irritability, anxiety, and even sadness. You might find yourself getting easily frustrated or overwhelmed even by small things. Difficulty concentrating is another hallmark of stress. Stress can also impact your behavior. You might find yourself withdrawing from social situations or activities you used to enjoy. Some people experience changes in their sleep patterns, either struggling to fall asleep or experiencing restless nights. And then there are the unhealthy coping mechanisms that some people turn to, like increased alcohol consumption, smoking, or overeating. These are just some of the common signs and symptoms of stress. It's important to remember that everyone experiences stress differently. So how do healthcare providers like myself actually diagnose stress? Well, it starts with a conversation. I always tell my patients, tell me what's on your mind, how are you feeling? Understanding your medical history, any family history of stress-related disorders, and your current lifestyle is crucial. We'll also talk about any physical symptoms you've been experiencing. Remember those headaches, muscle tension, and digestive issues we talked about earlier? Those can be important clues. A physical examination might be necessary to rule out any underlying medical conditions that could be contributing to your symptoms. In some cases, I might use questionnaires or standardized scales to assess your stress levels. These tools can help quantify the severity of your stress and provide a more objective measure of your symptoms. They often ask about your experiences with common stresses and how you cope with them. It's crucial to remember that diagnosis isn't about labeling you. It's about understanding what you're going through and finding the most effective ways to help you manage your stress. Remember, if you're feeling overwhelmed or concerned about your stress levels, don't hesitate to reach out to a healthcare professional. Now let's talk about how we can manage stress effectively. The good news is that there are many different approaches, and what works for one person may not work for another. It's often about finding the right combination of strategies. One of the most powerful tools you have is your lifestyle. Regular exercise, even something as simple as a brisk walk in nature, can do wonders for stress reduction. And don't underestimate the power of a good night's sleep. Nutrition plays a role too. A balanced diet can help fuel your body and mind to better cope with stress. And then there's the power of relaxation techniques like deep breathing exercises or meditation. In some cases, psychological therapies like cognitive behavioral therapy or CBT can be incredibly helpful. CBT can help you identify and change negative thought patterns that contribute to stress. Medication might be an option in certain situations, but it's typically used in conjunction with other therapies and lifestyle changes. Remember, managing stress is not a one-size-fits-all approach. It's about finding what works best for you and making sustainable changes that can improve your overall well-being. Stress is a part of life, but it shouldn't control your life. By recognizing the signs, understanding how it's diagnosed, and exploring the variety of treatment options available, you can take proactive steps to manage your stress effectively. If stress becomes unmanageable or starts to interfere with your daily life, it's important to seek professional help. Remember, there's no shame in asking for support. Thank you for watching, and remember to take care of your mental health. It's just as important as your physical health.